Welcome to G Fun Facts Online. In the world of medicine, you sometimes find game-changing breakthroughs in the most unexpected places. Imagine a drug used for centuries to treat an intensely painful joint condition, suddenly becoming a frontline defense against heart attacks and strokes, the #1 cause of death globally. That's not science fiction. It's the story of how a common medication for gout is rewriting the rules of cardiovascular health. Today, we're diving deep into the surprising link between uric acid, inflammation, and your heart, and how a staple from the medicine cabinet is being repurposed to protect our most vital organ. Let's start with the condition at the heart of this story: gout. Many people think of gout as an old-fashioned ailment, but it's a form of inflammatory arthritis, characterized by sudden, severe attacks of pain, redness, and swelling in the joints, famously in the big toe. The root cause is a condition called hyperuricemia, which simply means there's too much uric acid in your blood. Uric acid is a natural waste product. It's formed when our body breaks down substances called purines, which are found in many foods like red meat and seafood, and are also produced naturally by our cells. Normally, our kidneys filter out uric acid, and we get rid of it. But if you produce too much, or your kidneys don't remove enough, the levels build up. When uric acid concentration gets too high, it can form microscopic, needle-like crystals. When these crystals deposit in a joint, they trigger an excruciating inflammatory response, a gout attack. For decades, the primary health concern around high uric acid was limited to gout. But a massive body of research has revealed a much more sinister, systemic problem. Study after study has shown a clear and consistent link between elevated uric acid levels and a higher risk of major cardiovascular diseases. We're talking about hypertension, or high blood pressure, atherosclerosis, which is the hardening and narrowing of your arteries, atrial fibrillation, an irregular heartbeat, and even heart failure. This connection is so strong that some scientists have started calling hyperuricemia the fourth highest cardiovascular risk factor, right after the big three: high blood pressure, high blood sugar, and high cholesterol. The risk for dying from a cardiovascular event starts to increase at uric acid levels that are significantly lower than what's needed to even be diagnosed with gout. So, how does this waste product damage our heart and blood vessels? The mechanisms are complex, but we have a good understanding of the main culprits. First, uric acid is a powerful pro-inflammatory signal. It can trigger inflammatory responses directly within the walls of our blood vessels, helping to create and grow the fatty plaques of atherosclerosis. Second, it contributes to oxidative stress. The very enzyme that produces uric acid, called xanthine oxidase, also churns out a flood of reactive oxygen species, better known as free radicals. These are unstable molecules that damage cells, particularly the delicate endothelial cells that line our blood vessels. This damage, called endothelial dysfunction, is a critical first step on the road to heart disease. And third, high uric acid can activate something called the renin-angiotensin system, a hormonal cascade that plays a key role in regulating blood pressure. Overactivating this system leads to hypertension. With this clear and dangerous link established, researchers began asking a logical question. If the drugs we use to treat gout work by tackling uric acid or the inflammation it causes, could they also protect the heart? This question led them down two very different paths, focusing on two main classes of gout drugs that work in completely different ways. The first path led to a massive breakthrough. Let's talk about colchicine. This is one of the oldest and most widely used treatments for gout, a medication derived from the autumn crocus plant. When you're having a gout flare-up, colchicine is fantastic at reducing the inflammation. It works by inhibiting the activity of certain white blood cells that are key players in that intense inflammatory cascade. Now here's the brilliant leap in thinking. We know that chronic, low-grade inflammation is a critical driver of atherosclerosis. It makes those plaques in our arteries unstable and more likely to rupture, which is what causes a heart attack or stroke. So scientists hypothesized, if colchicine is so good at tamping down inflammation, maybe it could be used to protect the hearts of people with cardiovascular disease. This wasn't just a theory. They put it to the test in several huge clinical trials, and the results were nothing short of remarkable. Two trials in particular changed everything: the COL-COT trial and the LODOCO-2 trial. First, the COL-COT trial, which stands for Colchicine Cardiovascular Outcomes Trial. Researchers studied patients who had recently had a heart attack. They gave one group a low daily dose of colchicine, just 0.5 milligrams, and the other group a placebo. The results were stunning. The patients taking colchicine had a significantly lower risk of a combined group of events, including death from cardiovascular causes, stroke, or having another heart attack. This was a huge signal. But science demands replication. That's where the LODOCO-2 trial came in. This study, whose name means low-dose colchicine for secondary prevention of cardiovascular disease, was even bigger. It enrolled patients who had stable coronary artery disease, meaning they had heart disease but weren't in an acute crisis. The findings were even more impressive. Low-dose colchicine reduced the risk of cardiovascular events by a staggering 31% compared to a placebo. To put that in perspective, the researchers calculated that for every 1,000 individuals treated with colchicine for a few years, you would avoid 9 heart attacks and 8 strokes compared to the group not getting the drug. These two landmark studies provided undeniable evidence that colchicine's anti-inflammatory power translates directly into real-world cardiovascular protection. The findings were so compelling that in 2023, the U.S. Food and Drug Administration, the FDA, officially approved low-dose colchicine for a brand new purpose: to reduce the risk of heart attacks, strokes, and other cardiovascular events in adults who already have established heart disease or have multiple risk factors. This was a monumental moment. Colchicine became the first anti-inflammatory drug ever specifically approved to prevent cardiovascular events. It marked the dawn of a new era in cardiology, where targeting inflammation is now a recognized strategy, alongside managing cholesterol and blood pressure. It's an extra tool in the toolbox for high-risk patients. The good news didn't stop there. Further research from UVA Health suggested that colchicine might also significantly improve survival rates for patients hospitalized with worsening heart failure, likely by taming the massive inflammation seen in those acute situations. Other studies found that for gout patients who are just starting on uric acid-lowering therapy, a period where they can ironically have more flares and a temporary increase in cardiovascular risk, taking colchicine at the same time was linked to a lower risk of heart attacks and strokes. Now, no drug is without side effects. At the low doses used for heart protection, the most common issue with colchicine is gastrointestinal upset, like diarrhea. But for the vast majority of appropriate patients, the evidence overwhelmingly points to a significant net benefit. The story of colchicine is a triumph. But what about the other path? The other main strategy for managing gout is to directly lower the levels of uric acid in the blood. The go-to medication for this is allopurinol. It's what's known as a xanthine oxidase inhibitor. Remember that enzyme, xanthine oxidase, that produces uric acid? Allopurinol blocks it. This reduces the production of uric acid, preventing gout attacks. The hypothesis here seemed even more direct and compelling than for colchicine. If high uric acid is a risk factor, and the enzyme that makes it also produces harmful oxidative stress, then blocking that enzyme with allopurinol should be a double win for the heart. Early, smaller-scale studies seem to support this idea. Some research suggested allopurinol could improve blood pressure and have other protective effects on blood vessels. One study in older adults with hypertension found that using allopurinol was associated with a significantly lower risk of both strokes and cardiac events. Everything seemed to be pointing in the right direction. But the key, unanswered question was whether allopurinol could prevent cardiovascular events in a broad population of people who had heart disease but did not have gout. To get a definitive answer, one of the largest and most rigorous trials of its kind was launched. the All-Heart study. This was a huge, prospective randomized trial specifically designed to see if allopurinol could improve outcomes in patients with ischemic heart disease. The results were presented in 2022, and they were a surprise to many. The conclusion was clear and unequivocal. Allopurinol did not improve major cardiovascular outcomes. In patients with heart disease but no gout, taking allopurinol was no better than standard care. The study found absolutely no difference in the risk of heart attacks, strokes, or death from cardiovascular causes between the group taking allopurinol and the group that wasn't. This was a pivotal and somewhat disappointing finding. It strongly suggests that while lowering uric acid is absolutely crucial for managing and preventing gout attacks, it is not an effective strategy for preventing a second heart attack or stroke in patients who already have established heart disease. The benefits of allopurinol appear to be primarily limited to the management of gout itself. It's a classic case of a plausible theory that just didn't hold up under the scrutiny of a large-scale clinical trial. So, what do we make of this? The journey of gout medications into cardiology is a fascinating tale of two very different drugs, with two very different outcomes. The repurposing of colchicine stands as a landmark success. It's a paradigm shift in how we think about preventing heart disease. By targeting inflammation, a fundamental process driving atherosclerosis, this cheap, ancient, and widely available drug offers a powerful new way to protect high-risk patients. As one expert said, its approval for this purpose is a true game-changer. On the other hand, the story of allopurinol is a crucial lesson in scientific humility. Even though the link between uric acid and heart disease is strong, simply lowering that number with a medication didn't translate into the expected benefit for preventing cardiovascular events in the non-gout population. This divergence highlights a critical point in medicine: the mechanism of action matters. The cardiovascular benefits of colchicine come directly from its powerful anti-inflammatory effects, a pathway we now know is central to heart disease. The strategy of simply lowering a biomarker, in this case uric acid, with allopurinol, wasn't enough to move the needle on outcomes. For patients today, this means that an old, familiar gout medication has been given a vital new purpose, offering another layer of defense in the fight against heart disease. And for all of us, it's a powerful reminder that sometimes the most profound innovations aren't about discovering something entirely new, but about looking at the tools we already have through a fresh, new scientific lens.